Hi, this is Steve Adubato. We're coming to you from beautiful Camden, New Jersey. It is our pleasure to welcome our longtime friend, Rich Miller, who is the President and Chief Executive Officer at Virtua. Good to see you, Rich.
Good to see you, Steve.
This is your neck of the woods.
Yeah, it is. You're here in South Jersey. It's great to have you down here.
Now, when I got word not too long ago that Rich Miller was in fact stepping down at the end of 2017.
Correct, yes.
I said, wow, you've had an impressive, important career here. Why is it time for you?
Well, you know, actually this decision was made a couple of years ago, Steve. I mean, my wife and I talked about it 2 years ago, and I signed a 3-year contract and told my board that would be the end for me. So this has been in the planning mode for a couple of years, and frankly, been CEO for 21 years.
Has it been?
Yeah, I'll be 65 at the end of the year, so I said, it's time to do other things. I want to do other things in life, and I've done enough and done good stuff at Virtua. I'm really pleased with where it is. Time to do some other things.
Let's talk about it a little bit, big picture. Mm-hmm. And we've known each other a long time, and Virtua has in fact been an underwriter of our programming in public broadcasting for, I don't know, about a decade or so. But what I'm curious about is this. If you were to say one or two of the biggest lessons that you have learned as CEO at Virtua in this always evolving healthcare environment, biggest would be?
The biggest lesson I learned, I think, as a CEO is people are your most important asset, and having great people make great organizations. So, and I also will tell you that building culture takes a long time. And when I became a CEO at age 42, I thought I could build a culture in 2 weeks, and and I learned how stupid that was, and it takes a long time. But building great organizations revolve around great people. And as I look back, Steve, over 21 years, we're there. I mean, we've gotten there, and we've gotten there through hiring good senior leaders, and senior leaders beget great leaders throughout the organization.
Let's talk about the incredible changes in healthcare. Mm-hmm. So one of the things we've talked about over the years, Rich, is the delivery of healthcare and how it's changed dramatically. Mm-hmm. Describe where you believe we are today, but even more challenging, where you believe we think we're going over the next 3 to 5 years.
Yeah, I mean, I think I've seen a lot of changes in healthcare from basically years ago being a hospital model of care. Build it and they will come. People would come to the hospital for care. I mean, most of my business when I started as a CEO was inpatient. I mean, I would say it was 70-30.
They come to the hospital, stay for X number of days.
Go home, treat them, and our outpatient model wasn't that significant. That has completely shifted now, and when we sit here in 2017, to a model where outpatient becomes very important. So, you know, we're seeing knees and hips in 24 hours being done, surgeries being done.
I mean replacements?
Replacements, yeah.
In 24 hours?
24 hours.
Not the case 10 years ago?
Oh, 10 years ago it was a couple-week, 3-week stay. So now, you know, we're seeing technology turn around, and surgeons turn, you know, we're talking about hips and knees being put in with 1-inch scars. I mean, that's the kind of surgery we're seeing today. So the whole environment has evolved to an outpatient environment. And I would say 55% of my business today at Virtua is outpatient.
But beyond that, the delivery of healthcare also is being driven not just by technology. You've also talked to us about the demands that consumers, that patients and the families demand healthcare be delivered in a different way. Talk about that.
Well, I think part of it, and people demand it because the cost is so high. And once you come into an emergency room, Steve, in any hospital, the cost goes up dramatically, because if you're 9 out of 10 times or 70% of the time, you might be admitted to the hospital. And right there, the cost goes up. So the goal is now, and what you're seeing in healthcare, urgent care, you know, minute clinics by CVS, even other retailers putting in primary care centers. And the reason for that is to keep people out of the high-cost arena, which is the hospital. So that whole cost environment, where now, you know, a premium dollar for the average individual in the street's very high, right. And then you add on the cost of copay and deductible, which are going through the roof right now. People can't afford health care. So you want to keep them out of the hospital setting as much as you can and into lower cost settings.
One of the things that I'm always curious about for a CEO of a large healthcare system or a large organization is how much is unpredictable. So as we're doing this program, taping this program, as we move into the spring of 2017, it'll be aired after that as well. We don't know what the healthcare landscape is going to look like in Washington and how that's going to impact New Jersey, hospitals in New Jersey, the healthcare delivery in New Jersey. So as the Trump administration does what it's going to do, Congress does what it's going to do or not, we don't know. How the heck do you plan? How do you and your colleagues plan when you don't know what's going to happen?
Well, that's been the case for many, many years.
It's not different now, Rich?
Well, the reimbursement system, the way hospitals are paid, has always been a different. I've been through maybe 10 different models of payment.
How do you plan in that environment?
It's very hard. I remember when we had the all-payer, single-payer system in New Jersey back in the 80s and 90s, we were paid one rate for everything.
Is that the DRG system?
DRG system. And I went through that process, which was supposed to be a prospective payment system, Steve. It turned into a retrospective payment system.
I can't even believe I remember this acronym. I think it was called the Diagnostic Related Groups.
Right.
So somehow if you were diagnosed in a certain group, you got a certain payment for that?
Correct. And
Sounds
frankly,
simple, but
it was hard because, you know, you were paid off of what they call a base year, which could have been 3 years ago, and then you couldn't recover if you had a bad low-cost base year. It was a nightmare. So I've been through that scenario. You know, I've been through a number of. Then we deregulated in New Jersey in the 90s, and we moved to a deregulated environment where, you know, now you're negotiating rates with payers, and there's all different rates for all different disease categories. So the payment methodology will always change.
But what?
But the issue is going to be today, and I think the bigger issue is where does Medicaid go? And that's the one area, Medicaid. That's the one area now where, under the Affordable Care Act, the states were getting paid 90% on the dollar here for Medicaid.
From the feds?
From the feds. So if that goes back to the states to manage.
In block grants?
In block grants, which is a possibility, will there be enough money to take care of the Medicaid population in the state? Because frankly, New Jersey doesn't have the money to support a Medicaid program. And that's where I get worried, because people were covered right now. There was a lot more people that in underserved areas that had Medicaid coverage today because it was being paid for. And I think that's a good thing. I think the underserved population needs health care, and we need to take care of that population. So what happens if it goes back to the states and there's not enough money to pay for it? Or are those people covered? And you couple that with the fact that the state's phasing out the charity care program funding, that could create a huge hole for a lot of providers.
Rich, real quick, explain that charity care situation. People hear the term all the time. Charity care is?
Charity care charity care is for patients that really have no insurance.
So they come into the emergency room.
Right.
You have to, by law, treat them?
Yeah, by law.
And then what happens with that bill?
Well, what happens to the bill is, you know, Virtua, for example, has its own charity care program where we discount significantly the bill for a patient. But typically, a lot of times, we don't receive payment for that. So charity care is no pay. Medicaid, at least, you know, if it's 50 cents on the dollar, it's 50 cents on the dollar of cost. At least you're getting something. For charity care patients, you're getting nothing.
If I were to ask you what you're most proud of in your 2+ decades as the CEO of this organization, could you pinpoint that?
I mean, there's a lot of things I'm proud of. I will say it's building a culture of care at Virtua that's very special. I mean, to me, that we did our STAR initiative back in 2000, 2001, which was to build the culture. And people really gravitated to that because it's centered around the patient. So I would say if all the things we accomplished was building a culture of care that's very special and palpable in our organization and resonates in our community, because we're the healthcare organization of choice. And we're that because we provide great care, but we provide it in a way of compassion and caring that most don't. Many providers do, but not to the level we provide it.
Rich, we usually do not do this as broadcasters in public television, but I just want to say, because you've made this decision and you'll be off doing other great things. But I want to thank you for all the work that you've done in the healthcare community and the work that you've done at your place at Virtua, and we wish you nothing but the best.
I thank you, Steve. I look forward to the future. There's a lot to do, and I look forward to doing it. And doing things that I think can help community as well. Thank you so much. Appreciate it, Steve.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus New Jersey has been provided by Johnson & Johnson, Choose New Jersey, PSE&G, Kessler Foundation, New Jersey Sharing Network, the New Jersey Office of the Insurance Fraud Prosecutor, and by Gary's Wine and Marketplace. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.